Welcome to Tech Talks. I'm Holly Scott. Today I have the pleasure of chatting with Ryan Deboer, the CEO of the Shape Sensing Company. The Shape Sensing Company has a great goal of shaping the future of surgical navigation. I'm excited to hear all of that and what it entails. So thanks for joining us today, Ryan.
Thank you for having me, Holly.
It's a true pleasure. So let's jump in. Why don't you tell us a little bit about the clinical problem we're looking to tackle here with Shape Sensing?
Sure. So our goal is to reduce the complications that are associated with poor visualization during minimally invasive procedures. As a platform technology, we're fortunate that we can help out in a lot of ways, but one area that we're really excited to jump into is in the endovascular aneurysm repair space. These procedures are very long, and unfortunately, it's with often unhealthy patients. So being able to provide better visualization will allow us to reduce procedure times and the potential for complications during those procedures.
Exceptional. Those procedures are, gosh, I know it's a multi-billion-dollar market, right, in terms of endovascular repair alone. Tell us more about the current standard of care. What's the gold standard go-to right now for these procedures?
Sure, yeah. So today, doctors typically use X-ray to navigate devices within the endovascular aneurysm repair. They're using two-dimensional visualization of what are inherently three-dimensional structures to try to navigate these endovascular stent grafts into the right place inside the body. And unfortunately, two-dimensional views of three-dimensional structures just limits their ability to really understand where they are. And on top of that, X-ray only visualizes hard tissues, or it can't show soft tissue without the use of contrast. So they're using these flat images that don't have any roadmap of where they're driving these stent grafts. And because of that, they have a harder time putting them into the correct place. So the procedures end up being 2, 3, 4, 5 hours long. And unfortunately, those long procedures can be hard on patients.
Mm-hmm. Yeah, I can imagine. That's an incredibly long procedure, especially for a minimally invasive procedure. So many of the procedures that have moved to less invasive have saved hours and hours, going to minutes and minutes. So Ryan, why is endovascular repair your first clinical focus?
Yeah, great question. Bottom line is we got out there and we talked to people. We surveyed over 200 clinicians who practice in various specialties and asked them, where are your biggest challenges? Where can we help with this amazing technology? And the overwhelming response from vascular surgeons in particular was EVAR. The AAA procedure, abdominal aortic aneurysm repair, just didn't have the right tools. We had 85% of our vascular surgeons say that we need better tools for EVAR in particular. And they rated their current tools a 6 out of 10, substandard. It was the lowest score of all the doctors we spoke with. So the path was pretty clear. We needed to help these doctors, give them better tools to perform these procedures more efficiently and safer.
85%, that's substantial. Whew.
It is. Yeah, we were surprised to see that as well, but they certainly validated our path.
Yeah, that's an important one. And with, again, a $1.5 billion market in terms of opportunity there, it's a strong area to focus in. So tell us about the current standard of care, and especially when it comes to some of the new innovation that's supporting the endovascular cases, where there's benefit and maybe where better imaging might really help and augment the results.
Sure, absolutely. Yeah, so device companies have been advancing the technologies significantly over the past decade, and we've gotten to a point where doctors can perform these procedures using endovascular techniques more often than open techniques. And these technologies are great, but unfortunately, it leads to longer procedures to install these more complicated stent grafts. So in the most recent types of stent grafts that are the newest on the market, called TAMBI, doctors are performing the procedures and they have good outcomes. The radiation exposure is on average 80 minutes per procedure. And we've actually seen procedures up to 240 minutes of radiation. And that's not just procedure time, that's actual radiation exposure. So by allowing doctors to install or place these advanced devices using less radiation, we're allowing the procedures to be performed faster and a lot safer as well.
That's a great benefit. Is there a change in the way the procedure is set up? In other words, does it add time for bringing in another device? Does it complicate the actual surgical area with the tools that they have in place right now?
Yeah, great question. So the first implementation of our technology is going to be within a guide wire. And in procedures today, doctors already use a guide wire for placement of these devices. So we're basically just replacing their standard guide wire with our ShapeSense guide wire to allow them to see the guide wire in three-dimensional views in real time without turning on X-ray.
Simple. No change in the way they use it. There's no uptake on the education side. It seems like it would be a very easy swap out for them procedurally.
That's our goal. We want to make it as plug and play as possible with minimal impact on the procedure other than reducing procedure times.
Okay, terrific. So I was fascinated hearing more about the history of where this platform came from, right? So we're talking about the actual complexity and interesting characteristics of the guide wire itself, as well as the workstation. Can you tell us more about where it came from and the magic of the tech itself?
Sure. Yeah, so our goal, as I mentioned, is to make it as simple as possible for our users. But on the inside, it's very complex. It's such a cool system. Our roots actually are in space exploration, where the technology originally had started at NASA. And it's really cool to be able to say that the earliest versions of our technology were actually flown on NASA spacecrafts,
Wow.
flown into space to measure the strain on the wings of the aircraft. That's how it all started. So that was in conjunction with a previous company, and that fiber optic sensing technology, our CTO created a way to use that same technology to develop 3D shape. So we spun out the shape sensing company in 2020 to focus on medical applications because there's a clear need to improve the visualization there.
That's so interesting. It's funny, there's actually a lot of incredible crossover from space into medical over the years. You know, when you're a dinosaur in the industry like I am, being in it almost 30, I've seen some really great engineering competencies coming from one side to the other. And everything from haptics to shapes, even like surgical robotics. You think about the way and the console that are being developed for the surgeons. Yeah, it's been a really interesting area to see so much crossover. So that's really interesting. What brought you, Ryan, to the team? What drew you in? I know you have an extensive background in the med tech industry.
Yeah, great question. So as I mentioned, our CTO, he actually came out of NASA. He was an aerospace engineer. And our founding team is a bunch of really technical founders that are so smart, but they didn't have any med tech background. So they brought me in as a way to facilitate the entrance of this amazing technology into the medical space. My background, like you mentioned, is in med tech. I spent about 20 years between St. Jude Medical, Boston Scientific, and then a digital health startup called Rhythm Science, mostly on the commercial side. My degree is in electrical engineering, so I've got a good grasp of the core technology and can help facilitate, like I mentioned, the entrance of the technology to the medical space.
Excellent. This must be a really interesting complement to where you've been in terms of the area of focus and where we're going with this.
Oh, absolutely. You know, this really spoke to my heart when I first saw it. My background, like I said, was more in the field. I spent a lot of years in thousands of procedures, largely in the electrophysiology space. And during those procedures, I'm in the lab with the doctor, and we're all wearing these big, heavy lead aprons with a thyroid collar on, trying to stay away from the radiation coming out of the X-ray emitter. And I, fortunately, was able to kind of stand in the corner away from all of this. But the doctor and the staff, and of course the patient, are all directly underneath this X-ray C-arm. So I'm watching as this is occurring and seeing them, you know, fast forward 20 years, I have this opportunity to join a company that's revolutionizing the way that these procedures are going to be done, and I just had to take the chance. So I'm really fortunate to be part of this.
Yeah, it's interesting timing too, because I know you and I chatted offline about this, and I think it's important for the audience to understand that there's a benefit to being what we call a fast follower in terms of an entree into the market. So big organizations, Philips, Intuitive, they are looking at this space with serious interest and in it, so to speak. Tell us a little bit about what they're doing and where we fit into the bigger ecosystem.
Sure, yeah. So both these companies are now on the market. They've commercialized their technology and they're doing great things with it. Philips in particular has a non-fluoroscopic visualization system that is targeting the endovascular space, similar to where we're going. And that is called LumaGuide, and allows doctors to navigate a guide wire in the aorta to reduce procedure times. They've been showing great results with it. Their studies have shown reduction in radiation exposure by as much as 70%. And importantly, the reduction in procedure time has been shown to be up to 37%. And again, these are unhealthy patients. The more we can reduce the procedure time, the more likely we can avoid poor complications. Now, on the other side, we've got Intuitive, and Intuitive is doing great things. They've got the Ion endoluminal robot, and that robot is for robotic-assisted bronchoscopy, basically lung lesion biopsy. And they are by far the market leader in that space. They're on pace to perform 80,000, 90,000 procedures this year. They've got 600 robots placed. So they're out there showing that the technology is legitimate, that it's working, and the demand for it is through the roof already.
Yeah, it's important to understand, especially for entrepreneurs, future entrepreneurs in this space, that we've coined it co-petition versus competition. You know, you need to create a market, and it really does substantiate it when you have big leaders that are pushing out. But when you see an organization, in those two examples, when you see an organization like Philips, now is there intent to take that technology and really allow it to be utilized in every aspect that it can be? And have you, as a younger organization, capitalized on the ability to be nimble and agile and work where it adds value without the complexity of an overlay of a huge, substantiated, complex business that's capital intensive and legacy, right? Legacy agreements that really are your number one master. So I see that as a huge benefit for what you're addressing, because I know the endovascular side is significant, but this has opportunity in other markets, correct?
Absolutely, absolutely. And Philips has a big vision. You know, they see taking this to other places within the world that they live in, right? The vascular space is somewhere that they can do a lot of good with fiber optic shape sensing. Likewise with Intuitive, they have a lot of opportunity in the endoscopy space with the robotic tools. But to your point, yeah, absolutely. We've got more opportunity to be nimble, and really find broad applications of our technology across a number of different fields. So we plan on starting with the vascular space similarly, but we can very easily adapt working in endoscopy. We see applications in electrophysiology, orthopedics, beyond the core vascular system. We can go into cardiovascular and neurovascular. And really, the options are endless for where we can take this technology as a smaller company that can be nimble and find partners to do so.
Yeah, there's a real benefit to being, you know, somewhat agnostic when it comes to what you're tied to and where your focus can be. And what I also like about this platform is that you're looking at procedures that can be outpatient too. These are not necessarily tied exclusively to hospitals.
That's right. That's right. Yeah. Our goal is to make minimally invasive procedures safer and easier. So the more procedures that we can help take from these very expensive hybrid ORs out to either outpatient cath labs or even to surgery centers, the better. So our goal is to improve access to care, whether that's changing the location of where surgery is being performed or providing better tools to allow more physicians to perform these complex procedures.
Congratulations on being a MedTech Innovator cohort company.
Thank you. Thank you.
Quite an accomplishment. What's that experience been like?
No, I can't say enough good things about it. The whole environment, the community of MedTech Innovators is like nothing I've ever experienced. They're pairing us with some just top-notch mentors, and the mentors, what's great about it is that they're in different segments of the business. So whether it's product development or strategy or fundraising, I've got mentors in different places that can help me with different things that I may need some advice on. So that is been blowing me away in terms of the value it's providing. But on top of that, their network is stronger than I ever could have imagined. everybody in MedTech knows MedTech Innovator, and it seems like everybody at MedTech Innovator knows everybody in MedTech. So being able to put that on our website and on my pitch deck, it just adds another level of validation that I just couldn't imagine how much value it was going to add. It's just amazing.
Yeah, that's excellent. Yeah, it's interesting because there are a number of organizations that consider themselves technology accelerators, incubators, and yet there's nothing that is as altruistic for the industry as MedTech Innovator. And from the other side of the fence, you all have been through such a thorough vetting process when it comes to your mission, your market, your leadership, and the real platform, the area of which you're looking to go after, that investors take your organization seriously. People take your organization seriously. Strategics take the organization seriously. You know, so there's so many mutual benefits. And for people like us who are thrilled to have this partnership with such an organization, is it really does allow us to contribute to the ecosystem in a bigger way, where for so many years it was simply a service for hire. So this has been an incredible partnership, and glad to meet you through it. You're one of the benefits from my perspective.
And likewise, yeah, being able to meet people like yourselves and have the opportunity to share our story, to learn from people who have done this many times before, it's just been such a great opportunity.
Excellent. So what's our focus for the next, say, 12 to 24 months? What are some of your important goals that you have ahead of you?
Sure. So our goal is to put ourselves in a place where we can work with as many partners as we can handle, basically. And to do that, we're creating what we're calling a 3D guidance module. And that module is going to be able to be implemented into various platforms, so we can really scale this into all the procedures I'm talking about. So in order to do that, of course, we have to finish productization of the module, set up manufacturing, and then we need to be able to scale the manufacturing of our fiber optic sensors so that we can produce those in mass. So that's a real big target for 12 to 18 months. And then on top of that, of course, building more strategic partnerships along the way so that as soon as all that's in place, we're ready to rock. Excellent.
How can we get in, if people are interested in getting involved, whether it's our audience or strategics or anyone, how's best to reach you?
Sure. Can you email me directly at ryan.deboer@shapesensing.com. You can go to our website at www.shapesensing.com. Either way, and I'm also on LinkedIn. Would love to connect in a variety of ways.
Ryan, thank you so much for sharing today the journey with Shape Sensing, and we're rooting for you, and we're here as you grow. I'm looking forward to fast forward a few years from now, seeing great things happen. Thank you for sharing with Tech Talks and our audience.
Thank you so much, Holly. It was an honor to be on here. I really appreciate it, and thank you for the support.
And to all of you, thank you for joining us on Tech Talks. Until next time.